We're almost 5 years into Haelo, and what an amazing journey it's been. So 5 years ago we started with a lot of goodwill from the Salford partners and an ambition to help to improve the population's health in Salford. We've been part of the fabric of Salford, and I have just been so privileged to have been part of that. What have we done together? Well, our first programme was something that I think we all thought was really high priority. It was a programme to try to improve the uptake of health checks in Salford, which is a programme that has essentially been running quite some time and really aims to increase the number of people getting cardiovascular disease screening to prevent those kind of awful outcomes like stroke and heart attack, which we know people in Salford are at risk of. And we were only able to get about 30% of people into these appointments when we started. And we did some work, and we worked with people to kind of figure out what it was that was creating those impairments, those impediments. And over a period of time we tested, is it the way we're inviting people to come? Is it the conversations that we're having with them when they arrive? What seems to be the issue? Through that, we were able to increase that uptake of health checks from 30% to 70%. And when you look at the impact that that has the potential to have on health outcomes if people change their behaviour as a consequence, it's that kind of work which actually has created a sense in Haelo that this is a mission-driven organisation, and it's one where I've been really proud to work. So one of the things that we've been really focused on here in Haelo is trying to understand how we can improve improvement. And one of the things we've enjoyed is a really strong and positive relationship with our academic partners. And in particular, one of the highlights has been our long-term, long-standing relationship with the Manchester Academic Health Science Centre. One of our flagship programmes that the Domain has sponsored for 3 years has been the Improvement Science for Academics programme. The Improvement Science for Academics programme is something which will, I believe, go on to thrive under Haelo's leadership. It invites people who are clinical academics, who have good grip on research and training, to start to learn about improvement science. What that has generated, I think, across the Manchester Partnership is a new generation of clinical leaders who are able to really make an impact in the environments that they're working in. We have I think, a fantastic team of people here who have a real grip now on how you measure in a clinical setting, what the strengths are of that, what the challenges are with that, how you measure data over time. And it's because of their constancy of purpose, their constancy of wanting to know whether tomorrow's clinical care is better than yesterday's clinical care, that we have a kind of social movement around measurement. Safety thermometer, I think, hasn't just been a programme, it's been a defining characteristic of Haelo, and again, it's something now which is embedded into the fabric of NHS England, and yet we are still continuing to work with people who want to work with the data, and we're still continuing to better understand the nature of harm within the healthcare system and how it's improving as a result. We continue to ask questions and we continue to seek out improvement, and that is the very essence, the very core of Haelo, is we're trying to generate the new questions and push the envelope and be at the very leading edge of the thinking around particular issues, in particular safety, harm and population health. The city of Salford, during that time that I've been here, has just gone from strength to strength, from essentially an environment where the perception was one of challenge. We now have an environment of thriving people, living and supporting one another and helping one another to improve their lives and the wealth and the experience of their children. And it's just remarkable to see. Our floods film, which I think was a real masterpiece from our film guys last year, really did, I think, typify for me the spirit of Salford. Here in Haelo, we've been on a journey, and I think it's suffice to say that we could not have been as successful as we have if it hadn't have been for our partners in Salford Royal, in Salford CCG, in the City Council and in Salford University. We have also had the privilege and luxury of partners from national organisations like NHS Improvement and the Department of Health and all of our NHS Quest partner organisations. One of the things I'm most proud of is the team that we've been able to grow. That's going to carry on. I'm going to have a very, what sounds like an old fart role in all of this. I'm going to be a senior fellow, so I will be involved in getting people around Haelo who've been involved in the alumni networks and who are involved in the thought leadership and thinking about, right, what is it that we need to do next? How can we be an independent and robust voice back into the system to offer support, to offer challenge, and to look constantly at how we can do things better. Whilst everybody might think, well, you know, okay, it's quite sad, Maxine's moving on. What I can tell you is there's 35 more people here who are going to go on and they're going to change the world. So having been part of that is just phenomenal. And I want to thank them for everything that they've done.